gravid uterus. So this female German Shepherd is presented to us, with a vaginal discharge, and she was mated approximately 62 days before. So we did the ultrasound and found that there is a large macerated macerated fetus present, and she was facing a uterine inertia, so she was not pushing this fetus out. So we tried with a conservative treatment and management with the drugs, but she was unable to, push out the fetus. So we decided to do uh, surgery, and with the owner with the owner concerned, and owner don't want her to uh, get the babies done again. So we have decided to do a hysterectomy, uh, and इसको सेंटर में लेके आओ. And so we are doing this surgery. थोड़ा सा इसका ऐसे झुकाओ, इस साइड झुकाओ बेटा, बस. And now make it large, little bit. That's it. Okay, so yeah, we are going to do a surgery, a hysterectomy surgery in a gravid uterus. So the approach is same, and we'll be giving a central line incision. Linea alba. So I'll be going all the way like this, and we'll try to check the bleeders. And she has this discharge coming from last afternoon, and she was not trying to push the fetus out, and so she was presented to us in the morning. We did ultrasound, and found. And the bleeding, why she is bleeding so much, is because she has a hypertension, and so so I will stuck this for a while. Okay, so I'm going to give incision on here, separate. चेक करते रहना इसको. See if there is any adhesion. Okay, so now I will take out this Gravid uterus. So you can see it was just one puppy, and that started, that was dead and started macerating. So for those who are not, very familiar with the ovarian structure, so this is a ovary here. This is a ovarian bursa, you can say, part of ovaries here. This is a broad ligament. So this is a broad ligament. This is a broad ligament. So at the time of hysterectomy, you can simply tear this off, and it has no blood supply. So you can simply tear this off, and once you tear this, you can able to lift the ovary and the uterine horn up, and you can thus do ligation. So I'll do electroligation here, and I personally feel that electrocautery with the vessel sealer is a must thing to invest in your OT. So everyone who is doing surgery in their practice should have a basic electrocautery machine with a vessel sealing device. So that's really makes the work very easy. Okay, so before cutting it, I will hold this with a artery forceps, and then we'll cut to see if there is any bleeding. I'll double seal this, and it is done. We'll hold this and remove the artery forceps to see if there is any bleeding coming up. So no bleeding is coming up. We'll repeat the procedure here. So here also, this is ovarian bursa, this is a part of ovary, and now you can able to tear the broad ligament. You can also cut it if you want. So you can also just cut it. If you are not confident in tearing it, you can easily cut that. And इसको दबाना अच्छे से. So we'll do electroligation here. Okay, so now I'll hold this with the help of forceps, and we'll cut. And I will again hold everything in a hand, and will double seal it to make sure that everything is fine in its place. So it's gone. Now I will also seal the uterine attachment of the mesentery, just in case when I cut them there should not be any bleeder left. Similarly, I'll do that for this side. Okay, so we have now separated the two horns and we'll lift up. So this is cervix that I can hold off. So I'll transfix the cervix and will. Can I have a 2-0? Yeah, 0 ही दे दो, 1-0 ही दे दो, 1-0. इधर देखना जरा. So for transfixation, I will palpate, because this is a dilated cervix, so I'll have to palpate the fibrous part of it, and then we will give the transfixation. So while doing a hysterectomy in a gravid uterus, you have to pay a lot of attention to check the bleeders, because they have got a massive blood supply. So what I'll do is I'll seal this side of a major blood supply like this, and I will again lock this up with some knots. Cut उसको बड़ा ही करना, बड़ा 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 बड़ा. I'll repeat the procedure on the other side. So this is my cervix. इसको ऐसे ही रखूँगा तो sufficient. And then I'll go through the vessels over here. We'll lock them and go. काट दो. Okay, so now I will catch hold this part with forceps. I will catch hold another part with the forceps and will give a cut, and we have removed this gravid uterus along with the ovaries. Now, what I'll do is I will trim this fibrous part, and now I will do the and you can do this with a monofilament non-absorbable suture. That's what I am doing it here, and I always prefer this because of the durability and of course it's a cost effective, and it is not at all, if it is a monofilament then it is not at all, you know, irritable or going to cause any problem in the future. So that's really a, you know, safe thing. Okay, काटे उसको, छोटे छोटे बाकी सब भी काट दो. Okay, so now I'll just remove it and we'll let it go. So as this is completely a sterile part, you know, sterile way. We didn't, you know, open uh, the uterus, so there is no point of, you know, lavaging it. So I'm not going to lavage this. I'll remove this falciform fat. That may cause, you know, problem in, you know, healing. I'll let it down. Okay, great. So now can I have bupivacaine and clonidine? I'll remove this laminated part that will actually, you know, help me in my suturing. And we have got some bleeder some annoying dealer for the इसमें okay, great. Clonidine 0.4 डाल देना. इसका वजन कितना है? हाँ 34.3 0.3. So I am injecting combination of lignocaine and bupivacaine. Sure. 0 number. थोड़ा सा पूछ लेना. 0 number या 1 number 1 1 0 नहीं 1. Okay. Great. खींच के रखना इसको. So no need of giving any interrupted suture if you have given correct incision over the following the linea alba. So will heal very nicely. So that's an Virgin's knot, and now I'll continue this through the second layer. The bleeding that you are seeing, uh, especially when I take a bite, is because of the needle. So this is a traumatic, cutting needle. So it may cause some bleeding, but that really don't affect the healing. आवाज आ रही? सुनो इसमें। So we'll be suturing this as a second layer of suture, and then we will proceed for third layer. Okay, so we'll lock this up here. Bari kar lein. And इसको काट दो 30 दे देना 30 polyamide. So now I'm going to क्या हो गया कौन सा केस ठीक है 10 मिनट बढ़ा कर तो हो जाएगा कंप्लीट. Okay, so now we'll be closing this with and when you're giving a skin sutures, you have to be careful. You should not, give a very tight suture. So it should always be like this loose. Always go for a loose suture rather than a very tight one. कर दो उसका शुरू करो 0.5 देना. And I always prefer to give this interlocking continuous lock stitch pattern of suturing rather than interrupted, but that is fine. That's a surgeon choice. You can close by whatever way you want. जीरो कर देना इसमें. Yeah, this is it for the surgery, and thanks for watching. And we'll try to live stream some more procedures whenever I receive them. So please take care of yourselves and have a great Sunday ahead. Take care of yourselves and bye. And